All right, good afternoon. Snowy Monday to each and every one of you. Let me give you just a quick COVID update here, of course, with Josh and Paul and Dr. Marietta Vasquez, who's an infectious disease specialist, pediatric, Yale New Haven, was also on the CDC task force as they looked at prioritization in terms of vaccinations. Gives us some pretty good intel in terms of what the thinking is as we go forward over the next couple of months in terms of different populations, hard to reach populations, and the different vaccines and varieties that are out there, what a difference that could make. Let's give you a quick update on where we are in the numbers. Could you move that corner? In terms of what you see in terms of the cases, I think the good news is the positivity rate continues to trend down. I think for the first time in several months now, or almost several months, the positivity rate, 7-day average, is less than 4%. That's remarkable. Hospitalizations trends down. I think 912 is sort of 9 straight days of declining hospitalizations. As you remember, that was a pretty important metric as we figured out how we can open things up or otherwise. Fatalities are beginning to trend down a little bit, and that's, we got a long way to go there. Look, across the country, you'll see that, infections and hospitalizations across the country are down about 14%, so we're trending a little better there. Their fatalities are still trending up a little bit, but not for long. Let's get to vaccines. A couple of things on vaccines. Connecticut remains number 3 nationally, although Josh is a little cranky because given the snowstorm, we're not going to be able to vaccinate people today. So that could put us back a little bit, but not to worry. I had said I thought the next shipment of vaccines is going to come this afternoon. It's going to come tomorrow morning, but everything is still on track. And as you can see, we'll make up for that lost day, and everybody will be caught up by Sunday. A really good news that 45% of the folks 75 and above, those that are most likely to suffer complications, have been vaccinated, at least for their first vaccination to date. That's enormous good news. I'll show you in a second, though, the incredible disparity between towns, who's getting vaccinated and otherwise. And let me just give you a pause on J&J and the additional supply coming out, because there's been a lot of discussion about this over the last few days, if you watch the news shows and the such. Good news is, look, we've administered now 425,000 doses. We did 111,000 doses, so about a quarter, in the last week alone. We are ramping up. 86,000 have gotten their second dose as part of that package. But you've heard a lot about, hey, the different vaccines. I'm a Moderna man. No, I like Pfizer. They are only 3 weeks. J&J, I don't know, only 72% effective. That was all the discussion you had. I think it's worth remembering that all of these vaccines are incredibly effective at keeping you from severe complications, incredibly effective at keeping you out of the hospital, and virtually 100% effective at preventing fatalities. So if you get a chance to get a vaccine, you take that opportunity. I know you've heard a little bit about the different varieties out there, the variants, and we've gone from 8 to 16 of the variants. We used to call it the variant that originated in the United Kingdom, the UK, but Marietta has sort of informed me, let's call it the B117. Let's not tie it to any particular country where perhaps it was at one point. And okay, so some of the vaccines are more effective against the traditional COVID than, say, 1 or 2 of these variants. But the good news is that the mRNA, the nature of the genetic instructions that they provide, this is different than a traditional vaccine where they just inject you with a little bit of the virus and you build up antibodies. Here, the mRNA vaccines are very adaptable. What they do is provide genetic instructions, which in effect protect your body from the virus. So we've been spending a fair amount of time talking to the pharma companies, and they respond with a high degree of confidence that even though there are different varieties coming out of UK and South Africa and Brazil, and some are more effective than others, they're also going to be very effective. We will be effective. Our pharmaceutical companies effective in upgrading these vaccines, coming up with booster shots that make them even more effective against these variants if they catch up. Right now, 99% of ours are in the traditional mode here in Connecticut, but that's not true everywhere else around the country. This little chart is interesting. You can get that on our COVID website. It's an interactive chart. And what it does is show you by your town the percent of folks, mainly those 75 and above, who have been vaccinated, at least with their first vaccination. And you can just hover over the screen, go to your town, and see how well you're doing. And this is not a competition, but it is worth noting that Oxford and Wilton and Roxbury and Hebron and Essex and Marlborough are our champs so far. They have over 80% of their folks 75 and above. Over 80% have had at least their first vaccination, and that's important. A little push to some of the folks that we got to do better. We're going to work with you to help you do better. These are some of the towns that have less than 25%. So if the winners are at over 80%, New Britain, Winchester, Thomason, Bridgeport, all at less than 25%. So we're going to help catch up there, make sure this incredibly vulnerable population gets their dose. And I'd like to think within 10 days, 2 weeks, we're going to be making available the vaccines to the 65 and above group as well. One reason we've been able to keep up with the vaccines and make sure that they were not sitting on a shelf, but actually were a shot in the arm, is because of the incredible number of volunteers that have stepped up. They've gone to ct.gov, Step Up Connecticut. 4,000 Medical Reserve Corps volunteers have stepped up, and it makes an enormous difference. Some of them are retired nurses coming in, helping with the vaccination. Some of them are smart people, pretty good with an iPad, help us administer this and track it going forward. But it could not be more important. What you do is help us stay ahead of these variants and get people vaccinated in a real way. Look, we call the vaccinations a shot in the arm here in the United States. In Britain, they call it the jab, and number of people who are getting the jab. And so we like to think that jabs and jobs go hand in hand, and that's how we're going to beat this COVID and get our economy back on its own 2 feet. In terms of slowly getting back to a new normal, our better numbers are allowing us to slightly relax some of the restrictions. I alluded to this last week. One, our houses of worship have been extraordinary, considered somewhat risky, generally oriented towards an older demographic. Well, that older demographic is getting vaccinated. Our overall community spread is down. So we're going to keep the 50% capacity rule, which is true of most of our other retail establishments, restaurants as well, but there's no cap. And I think that makes a difference. That was the source of some lawsuits out there in other states. So I'd like to think we're making a real difference there. Mask and distancing required. That's true. Let me just give you a heads up. What I've heard from other governors say, don't tell people, just sit 6 feet apart. When you go to that house of worship, show where people should be sitting, not where not to sit. Show where they should be sitting. And that makes, following the protocols a lot easier to do. And again, in the business curfews, primarily restaurants, but bowling alleys and some other facilities, we had a 10 o'clock curfew. Now we're going to extend that to 11 over the next couple of days. That will be implemented. Our rates are down, allows us to do it. I think restaurants in particular have really operated professionally, doing everything they could to keep you safe. B, our friends in New York have relaxed to a 10 o'clock curfew. We're at 11 o'clock. They're at a 25% or 50% occupancy. We're at 50%. And our friends to the north, Massachusetts and Rhode Island, they've lifted the curfew, but they're at 25%. So we're all more or less on the same plate. And I think what a difference that's going to make. And it gets us back, as long as you're cautious, to a new normal. Finally, I think you've sort of seen this slide before. But look, we got the variants, we got the vaccines, we got more vaccines, things are changing. What do? I got the highly infectious B117 coming. Do what you've been doing. Watch your distance, keep the 6 feet, wear your mask, wear your mask, wear your mask, and wash your hands whenever you get the opportunity. You know that, Marietta Vasquez, I'd like to just introduce you. If you could talk for a couple of minutes about the amazing work you've done in explaining the importance of vaccinations to different populations around this state and the different vaccines themselves.
Yes, thank you. It's a pleasure to be here, and thank you for all you do. I'm Marietta Vasquez. I'm originally from Puerto Rico, but I've been living in Connecticut for close to 27 years. I'm a pediatric infectious disease specialist, and vaccines are my area of expertise in terms of research, policy, and advocacy. And I know that it's been a long time that COVID fatigue sets in, but we have some new information to share on the topics that the governor was talking about, and the topic of this new variants, what this means for us, how worried should we be, and then in terms of vaccination and then sort of how we put this all together and what to gather from this. In terms of the variants, this is expected. Viruses mutate, and we've all been cognizant or aware of the fact that the longer a virus is circulating in a community, something about it is going to change. And this is the virus's way of remaining fit to circulate in the community, because they're quite savvy, right? You throw a medication or a type of treatment, and the virus is going to try to figure out how to survive from circulating in the community. And thus far, there have been 3 variants that have been identified. They've been identified in different countries, but that doesn't necessarily mean that's where they were born, so to speak, or developed. We really haven't been looking for these variants on every single case of COVID. The information is emerging, but what we know so far is that of these 3 variants, one, the B117 that was identified in the United Kingdom, there's a second one that was identified in South Africa called the B1351, and the third one that was identified in Japan in travelers who were coming from Brazil, and that one's called the P1. That what we know so far is that all of them seem to be targeted by the vaccines that we have currently in the market, which is obviously very good news. But they each have sort of their differences. You know, we can go into it during the questions, but it's important for us to know that they're there. Even more important for the second topic, which is vaccination. What are we going to do about these? First of all, feel quite confident that not a specific group of researchers. We're talking about the entire scientific community in the entire globe. This is the focus of pretty much everybody who is able to study and be able to do research on this. And more information is going to come. As the governor mentioned, our vaccines are really our best strategy, hand in hand with all of the protective measures that we have. And the more individuals who get vaccinated, the less virus that's going to circulate in the community, and the fewer opportunities that if these mutations or variants continue to occur, they will have an impact on the health of people in Connecticut and in the United States and around the world. The vaccines, again, as the governor mentioned, both of the vaccines that we currently have in the market work well. They're vaccines that we call, they're very immunogenic. And what that means is a vaccine works by the person receiving the vaccine, whatever you get in your body tricks your immune system into thinking you're infected. And then your body starts developing protection. Why? So that then when you're faced with the real deal, COVID in this case, then you're protected against infection, against hospitalization, and more importantly, against death. And these vaccines are very, very good at tricking us into developing protection, not only in young individuals, but also in the elderly. The majority of the vaccines that we have in the market right now tend to be less effective as we age because our immune systems are not as robust. But the COVID vaccines in the market right now are very, very immunogenic. And these are not the only two vaccines. There are many other vaccines, again, as the governor mentioned, that are coming down. So I think to sum it up, there are great strategies in our armamentarium right now. I know we're tired of the mask and the hand washing and the social distancing, but we need to continue to do that. And very important, if you have the opportunity, when it is your time to get that vaccine, if you choose so, which I hope you do for yourself, for your family members, and for our communities, get vaccinated.
Thank you, Dr. Vasquez. Josh and Paul are here. Any questions?
All right, once again, we'll ask our reporters to be judicious with their follow-ups to make sure we get through as many questions as we can. We'll start with NBC Connecticut.
Good afternoon, Governor. Any idea how many vaccination appointments were canceled today because of the storm?
Do you know that, Josh?
Yeah, we don't have a precise number. We think it's a little over 10,000. We have had some of our providers continue through the storm. Hartford Healthcare, Stanford Hospital, others have forged ahead, but we do know there's been a significant disruption today. People who had appointments canceled should hear from that provider to help them reschedule. We've asked all providers to extend their hours through the rest of this week, through the weekend. We want to get everybody who had an appointment canceled today caught up before the end of the week.
Speaking of canceled appointments, I don't believe this was weather related. Over the weekend, we heard a couple of hospitals canceling them just because they didn't have enough vaccine. I know when we've asked in the past about this happening in other states, you indicated that we were only booking appointments for the amount of vaccine we had so that we wouldn't run into that issue. So what happened?
Yeah, we did have a couple of providers who booked more appointments than they had commitment for vaccine from the Department of Public Health. So that shouldn't happen going forward. There's some communication issues there that I think have been ironed out, and hopefully we won't see that happen again.
Okay, and also you had said recently we have a deal with surrounding states to vaccinate people who work in one state but live in another. Can you tell me how many non-Connecticut residents have received vaccinations here in Connecticut? Are they taking up spots that are supposed to be for residents?
Don't have that exact number. We can get that, but keep in mind we'll have Connecticut residents who are being vaccinated in New York and Massachusetts and Rhode Island as well. So we'll keep an eye on it, but at this point we don't think there's anything out of balance there.
It's reciprocal.
Correct.
Okay, and then lastly, any consideration for allowing people 65 and older who live in a household with someone that's over 75 be allowed to get the vaccine sooner?
Sooner is, 10 days, so that's going to be pretty soon.
Okay, thank you.
News 8.
Good afternoon, everyone. Governor, you mentioned how the trends, certain important numbers are trending in the right direction, and really talked about the fact that volunteers have been a big part of this. Any idea comparing what's happened in Connecticut with those volunteers as compared to other states with people volunteering?
I can't speak to that. I can't speak to the fact that the volunteerism has been extraordinary in Connecticut. You know about the young people who are helping out in the classroom. You know about all the folks that were there for track and trace. You know about here's one that sort of struck me. We had to reschedule a lot of appointments in New Haven for reasons you can well understand. The Board of Alders said, let us call up. We'll call our constituents over the age of 75 and tell them we can reschedule it as another date. So I've been pretty impressed with the people standing up and making a difference.
The change now to 11 o'clock curfew as opposed to 10 o'clock. Do you see, I know that's just happening along with the House of Worships within the last couple of days. Is there something on your mind that would be the next step, the next change, if the numbers continue trending in the right direction? Something else that you would either enhance or open that has been previously closed?
Let's see how this settles out for 2 or 3 weeks. But maybe at some point it's a little safer to put people in the stands and let a few folks watch some of the games.
And lastly, for Dr. Vasquez, there was a time, maybe a few months back, where there was a lot of concern with a lot of the healthcare workers because hospitalizations were piling up. Now those are heading in the right direction too. So are you in agreement with relaxing some of the restrictions as the governor has recently done?
I think it's a good idea to have the changes be harmonized with how full or available we have hospital beds in our state. So I would say, to the degree that those two go hand in hand, that we're not relaxing when we need to turn cafeterias into hospitals. Yes, I'm in agreement.
Thank you.
News 12 Connecticut.
Hi, everyone. Josh, you mentioned that you're hoping to get everyone rescheduled by the end of the week. Are you planning on getting all those people, all those 10,000 people vaccinated by the end of the week, or just rescheduled?
Our goal is to get them all vaccinated, to get those appointments rescheduled and get people back in before the end of the week.
Are we expecting the mass vaccination sites like Rentschler to reopen in the morning?
A little early to tell at this point, but the teams are going to be working around the state and all of our provider locations to get open as quickly as possible.
And Governor, I think you mentioned, correct me if I'm wrong, that today's vaccine shipment did not arrive. Is that expected tomorrow?
Yes.
Great. And just one final question. Can you just, Governor, update us on where we are with storm cleanup, how long you expect the tractor trailer restrictions to last, et cetera?
I can tell you that probably through the night. I haven't gotten the final, word yet from our Emergency Operations Center. They're tracking this pretty carefully. As I described early this morning, though, John, it's a severe storm, but really severe in terms of its duration as well. So we have 600 plows out there going virtually a nonstop, trying to keep up. So I think it's going to take a little bit longer. Paul, anything to add on that?
No, Governor, you just about hit it. We're going to be providing the governor an update after this call, and any other further decisions that would have to be made, we'll communicate it out publicly. But overall, we'd like to thank the men and women of the Department of Transportation for all their work through this storm, and also for everyone else who heeded the governor's call to get home and get off the road so they can be able to do their jobs.
Was there ever a thought of banning non-essential travel like New York City did?
Not at this point, no. Look, I strongly encourage everybody to stay safe, stay home. We told everybody, if you did leave this morning, like a lot of people did, probably oriented towards the office, turn around and go back. Rail service and buses are being curtailed. But no, I was not banning any people.
Channel 3 Eyewitness News.
Yes, Governor, talking about navigating the backlog, you were mentioning extending the hours. Do we have any details on that? Are we going to be considering a 24-hour approach this week, or?
That seems a little much, but Josh?
No, it's going to vary location by location, how many appointments needed to be rescheduled. But I think all of our providers understand that we're in a race right now against these variants, as Dr. Vasquez and the governor mentioned earlier. And so we just need people to be all hands on deck, do whatever it takes to get these people back in, get these vaccines caught up by the end of the week. It's a unique moment in time right now, and we need everyone to do everything they possibly can to get us caught up before the end of the week.
And we are hearing from some people who got their appointments canceled and are having a hard time rescheduling through their provider. What do you recommend they do right now? Is there anything that the state can help with?
Sure. Well, again, we have, on our website, the location of all the vaccination sites around the state with the different ways to reach them. But we are asking all providers to work with the people whose appointments they canceled and to help them get rescheduled. So hopefully that scenario you described is rare.
Thank you.
Fox 61.
Hi, Governor. When does that 11 p.m. curfew, I know you mentioned in a couple of days, but when does that extension from 10 to 11 go into effect?
I think David's going to try and get that done within 24 hours or so.
Okay. And then we also talked about how many appointments had to be canceled, but do we know how many vaccine doses were set to be delivered today that are now getting pushed to tomorrow morning?
Yes. So we are expecting, including first and second doses, we're going to get about 98,000 doses delivered this week.
Are all those doses supposed to be delivered tomorrow, or is that just going to be throughout the week?
Yeah, we expect to get most of them in tomorrow now.
And then lastly, the extension of hours to catch up on appointments, will that be a requirement or a suggestion for healthcare providers?
It is our strong suggestion, and if anyone's having challenges with that, they should reach out to the Department of Public Health, and we'll do everything we can to help those people find other locations.
Thank you.
WTIC 1080 News.
For Dr. Vasquez, the vaccines, we got them faster than most other vaccines are produced, and they're more effective, you're saying, than other vaccines have been. What, in your mind, we talk a lot about what makes the distribution not what it could be to this point, but what makes the vaccine program effective so far?
Are you talking about, thanks for the question, are you talking about in our state or as a country?
Yeah, as a country, what's so effective about these vaccines? What's special about this program that other vaccine efforts in the past that have taken longer or aren't of the same quality didn't have?
I mean, I don't want to talk about quality. They're just different. Some important points are worth emphasizing. One is that the technology of these vaccines is different. This is not a killed virus vaccine or an attenuated or an adjuvant vaccine. So that in and of itself makes it special. Now I'm sure that in a few years, if we look back, in spite of all the tragedies, one of the sort of silver linings is the incredible success of being able to develop effective vaccines with new technology in a short period of time that are already saving lives. What makes it be very high effective? I'm not going to compare because it's hard to compare one vaccine to the next. But what makes it very very effective or have higher efficacy, it's ability to not only mount an increased concentration of antibodies, and this is what your body makes when you get vaccinated, and what protects you. When we measure those levels of antibodies, they seem to be much higher with this vaccine first. And the second thing is that persons of all ages respond to them. As I was alluding to before, the older I get, unfortunately, the less robust my immune system. I don't respond in the same way. My immune system has been around for 50 some years. With the COVID vaccines that we have in the market, they are very immunogenic in older individuals. And isn't that fantastic? When we look at COVID disease, the majority of the mortality occurs in persons of older age groups. So I think that's one of the things that leads it to be very successful. And the other one is, in terms of vaccination programs, it's not just a small group of the population saying to themselves, gosh, I really worry about varicella, I worry about chickenpox. Now we have, not only the entire nation, but the entire globe around it. So I, as a provider, as a scientist, feel confident. I feel confident in the science behind it. I feel confident in all of the programs that have been put into place to get this vaccine to be licensed, and even more surveillance that is in place to be watching what happens with this vaccine, to make us understand that we don't know everything, but everybody's looking for what may arise, and the scientific community is invested in looking for solutions to new arising problems, such as the one of the variants. And I'm also confident in the systems that are put into place to bring the vaccines to the population. As physicians, we work during the day, and when we're off, many physicians are volunteering to be able to provide vaccines to the population. Is it perfect? No. We're fortunate. We're of all the states, we're the third state with the highest rates of vaccination. We have a lot more work to do, but there are systems in place. So I think, there are a lot of pluses and a lot of reasons behind why we think that that this is going to be a successful program.
Thank you.
I hope that answers your question.
The Associated Press.
Good afternoon, everyone. Obviously, all these vaccines are effective in some measure, but as different vaccines come out, how is the state going to decide who gets which vaccine? And are people eventually going to have a choice as to which vaccine they get? And how is that going to work?
I don't know about the choice. This is already one complicated Rubik's Cube. 3 weeks, 4 weeks, this essential group, that age group, broken down by town. And the point I was trying to make is these vaccines are all incredibly effective at keeping you out of the hospital and preventing death. So I would not get hung up on the brand name, and I'd be happy with the fact that when the vaccine is available to me, take it.
And Dr. Vasquez, do we know yet whether this vaccine is going to be like the polio vaccine where you get it once, maybe a booster, or is it going to be like the flu vaccine where we have to get it every year?
It's a great question. We don't know. And we have become very comfortable with uncertainty. What we know is that secondary infections are uncommon, that when they occur, they tend to occur not within 90 days or 3 months from having your infection. Whether the vaccine immunity, the vaccine protection is going to be the same, better, or not as long-term as the real deal as infection, we don't know. For now, the way I see it, I want to get vaccine as quickly as possible. I got mine. I can't wait for my family members to get theirs. If it ends up that the variation, not just small mutations in the alphabet that makes up a virus. Think of, letters, and mutations are changing. Instead of ABC, you took out the B and put in an N, for example. If there are big changes in coronavirus, that may lead to the vaccines that we have in the market not targeting the virus circulating in the community. There will be new ones, and we may have to get it every year. At this point, we don't know.
And due to your specialty, I'll ask this question. How concerned are you about this Kawasaki-like problem in children? And do we know whether the variants, whether it's worse or the same, or how dangerous are these variants to children?
So as a pediatric infectious disease specialist, I've taken care of many of the children with, it's called MIS-C, multi-inflammatory, multiple inflammatory syndrome after COVID. It tends to be a post-COVID manifestation, not a disease that children get as they are infected. We haven't been immunizing or vaccinating many children, so I think it's too soon to tell whether vaccinating is going to have an impact on the Kawasaki-like manifestation of the disease. I think if enough of the adults get immunized and hopefully the rate of infections becomes low enough, it will also decrease along, hand in hand with acute infection in adults. One thing I can tell you, it's a MIS-C, it's a very serious disease, and even though all of the patients that I've taken care of ended up in the hospital, their outcomes are very good. All of these children are now home and doing well. So I don't know exactly if there's going to be a relationship between the two, but I am not worried about vaccination and an impact on the Kawasaki-like manifestation.
Thank you very much.
The Connecticut Mirror.
Thanks, Max. Two lines of questions. First, my quick look at it, it seems there are a lot of cities, Bridgeport, New Britain, Waterbury, Bristol, that are in the lower percentages of vaccinating people. Is there some concern that some of our cities are lagging behind, so a better way to put it, and some of our bigger cities are not vaccinating as many people as some of our smaller towns?
Well, I'm told that Stanford, some of our cities are doing better, and we're going to help them do better. I mean, some towns have the worried well. They can drive right through the clinic and lickety split, there you go. Other, more congested communities, multifamily communities, we have to do a better job of getting our mobile vans out there. Sometimes there's some hesitancy, convince them how important this is. This is why Dr. Vasquez is on today, just to remind people how important it is to get that vaccine. And we're going to catch up. Anything else on that, Josh?
No, I think that's right. And it's very much related to what the governor discussed last Thursday, in that we anticipate this challenge. This is a challenge we're seeing around the country, and that we have to be very deliberate as a state to bring vaccine to communities that have been underserved and disproportionately impacted by COVID. And so it's a major focus of all of our efforts under the governor's direction to be very deliberate about that. It's why the additional doses that were allocated to the state this week were directed into those communities to give them more opportunities to do those clinics and outreach.
And on the variant, you haven't given an update. Have we not had any more than 8 cases of the variant, of the British variant, or whatever we're calling it?
Another 8 were diagnosed over the weekend, bringing us to a total of 16.
So we're at 16 now? Okay. And Dr. Vasquez, I wanted to ask, do you think that the variant is much more widespread, not only in Connecticut, but across the country than we've seen so far? I mean, I guess it's difficult to test for, and do you get a sense that it's clearly more widespread than we may think?
I can't say it's clearly more widespread, because to say that we would need to actually have proof. but I think it's very likely, and I think what this shows is a couple things. One is the importance of surveillance. I think the variants will continue to occur. I think it's very time consuming, it's very expensive, and labor intensive to do it, but I think it's very important for countries and communities to be doing the test to detect them. So the test that a person who has symptoms, they go through the drive-through, they get the swab in their nose. The majority of the time, that test is just to detect the virus, positive or negative. The test to detect the variant is actually taking that virus and decoding it, getting back to my example of the alphabet, saying when we say positive, can we actually look at all the different components of that virus? Doing that over and over again for all of or for many, or a sample of those viruses, that's how you detect them. We have great surveillance systems in place, but we are not at the stage where the majority of the positive samples are being tested to detect the variant. It's something that, looking forward, I think we're going to have to do. Again, if individuals in this country, and it's their time, go and get vaccinated, and we take this humongous number of cases and bring it down to a more manageable one, then what we are suggesting of, spelling out or typing these viruses is going to become more of a manageable thing to do. Right now, I'm saying that's the ideal, but is it feasible? Probably not, with the huge number of cases that we continue to have. But it's important to keep evaluating.
Thank you.
The Hartford Current.
Hey everybody, this is Emily Brindley from The Current. The first thing that I wanted to check about, Governor, is the easing of restrictions, both for the houses of worship and for the restaurants, but particularly for houses of worship. You said that one of the reasons that you feel comfortable taking this step now is because that older demographic is starting to get vaccinated. But you also said that we're at about 45% of those who are 75 and older. So why did you decide to ease restrictions now as opposed to waiting a few more weeks when that population might be up to something more like herd immunity?
That's a fair question. Look, probably safer to wait a few weeks. But as you know, Emily, I said if you're older and you haven't been vaccinated, I'd worship by Zoom. I think it makes all the sense in the world. There's some legal stuff all floating around out there. I figure we can sweep the deck and take that off the table. So we've done what we've done in terms of lifting the cap on houses of worship, but let's do it safely.
Yeah, and I'll also add to the governor's comment. There was legal challenges taken in other states as it deals with particularly the cap that is put forth on our houses of worship. Our legal team did an evaluation, provided a recommendation to the governor, in addition to looking at other variables as well. As the governor stated earlier in the call, it's also still important that there are mask wearing and distancing that still occurs, even though the cap will be removed. But as the governor has also stated, he recommends that everyone stay safe as much as possible, even including in their houses of worship and worship services.
Okay, thank you. I appreciate that. And then I know that other people have also asked about the situation with the appointment cancellations at UConn Health and I believe also Waterbury Hospital. What we have heard from UConn Health is that they had been receiving a pretty steady number of 1,500 doses per week, and that for this week, the state cut it down to 500. So that makes it, if their allocation is subject to such fluctuations, that obviously causes some issues when they're trying to plan ahead and make appointments ahead of time. So is that accurate that their allocation dropped so much? And how are vaccine providers supposed to plan ahead if they are subject to such fluctuations in their allocations?
Well, remember that 2 weeks ago, we got an extra 50,000 doses from the federal government. So there were a lot of providers around the state who got more, in the prior weeks. But again, they need to make sure they're synced up with DPH on what they can expect going forward and not assume. And that's, I think, what may have happened here. That said, look, we're still in the first weeks of this rollout. The visibility into what we're getting as a state from the federal government has been, to this point, pretty unclear. The volume of doses we're getting has been very uneven up and down. But we are hopeful that in the weeks ahead, that'll settle down. The Biden administration is committed to 3-week forecasts. We can then provide 3-week forecasts to our providers. So I think the collaboration, for the most part, is really strong across the state. And as we get through the next couple of weeks, I think you'll see less issues like that. There's been very few to begin with, but we'd like to get that down to 0.
And what day of the week are vaccine providers notified about their allocation for the coming Monday?
So if I remember the process correctly, we asked for their requests on Tuesday. We reconcile that and communicate back with them on either the Thursday or the Friday when we were allowed to place our order with the federal government for the vaccine that then arrives the following Monday, Tuesday, Wednesday.
Okay, so that only gives them, that only gives them a few days to plan. So what would you recommend? Because you say that you don't want them to assume anything, but they are also trying to, schedule appointments for the whole next week and all of that. So what would you recommend for vaccine providers if they only have a few days to plan so that they aren't just assuming what their allocation would be?
Well, we've had to assume the same thing, Emily. I mean, keep in mind, up until this point, we haven't had visibility into what we were going to be getting the following week. So we can't provide certainty to someone when we don't know what we're going to be getting. So fortunately, as I mentioned, the Biden administration is committed to 3-week forecasts. I think that'll make things much better for everybody and enable us to give providers a 3-week forecast horizon.
All right. Thank you, everybody. Appreciate it.
The Waterbury Republican American.
Thanks. I'd like to just follow up with Josh just to confirm. So the situation at Waterbury Hospital, that was a case where an assumption was made that they'd get a certain amount of vaccines and they didn't?
Correct.
Okay. Do you know how many vaccines that they were expecting and how many they got?
I don't have that in my hand right now.
Okay. Okay. And just another sort of housekeeping question for our neck of the woods. Is there any update on the Department of Health inquiry regarding the distributions of vaccine in Region 14 with some people who apparently have no involvement, direct involvement with students for getting vaccinated? Any update on that?
Not for me.
No update right now, Paul. We'll be happy to have any follow-up offline for you on that matter.
Sure. And getting back to the houses of worship, were you guys served with a notice of intent to sue on behalf of any religious organization regarding this limit in Connecticut? Were you in conversations with folks who said that they were gonna sue? I'm just wondering what prompted the legal analysis from the governor's counsel's office.
No, nobody served us any papers, but we had some conversations and we were urged to make the decision. We made the decision. We're going to do it safely.
Okay. And, obviously, we're all dealing with a vaccination program that the likes of which no one has dealt with before. And it's the winter and things like snowstorms disrupting traffic and business and commerce and schools and all that sort of thing happens. But is there any kind of estimate? Is it like a butterfly effect here? Is there any kind of estimate on sort of how this will ripple out in terms of the timetable for scheduling? I know you set the goal of rescheduling and getting people vaccinated by Sunday. So I'm just wondering, any estimates on if there's going to be any kind of appreciable delay or elongation of the vaccination schedule?
I don't think so, Paul. I think just the opposite. Josh said we're working all the providers. We're going to catch them up, and we're going to have everybody should have been vaccinated this week, vaccinated on time by the end of this weekend.
And just one more question for me. If Josh could break down that 98,000 in terms of how many second doses and first doses?
Sure. So we're going to be getting 57,000 first doses and 41,000 second doses.
Okay, and does that reflect, because I know you guys said last week we were going to start getting, I think, was it 9,000 more from Moderna in weekly shipments? I just going off the top of my head, so.
Yep, that 57,000 first doses is a nice increase from where we've been over the last couple of weeks.
Okay, so it's been about, what, 46.9? That's been the average?
That's right.
Wasn't it?
Yeah. In that
Okay,
range,
thank
yeah.
you very much. That's all for me.
Hearst, Connecticut Media.
Thanks, Mask. Mask. Yeah, Max. Thanks, Max. I've got 3 quick questions for Josh and one for the governor. Emily Munson down in Washington wants to know why Connecticut has not submitted an expedited request for FEMA to reimburse Connecticut's vaccine distribution costs.
We are in active discussion with FEMA about reimbursement for a variety of vaccine and other related costs. So I'm not exactly sure what the question's referring to.
I guess there's a difference between a normal request and an expedited request. I'm not sure.
Okay. Well, there's nothing slowing down our response with regards to the vaccinations or anything else related to COVID for reimbursement, but I know our teams are in active discussion with the FEMA team about what we can get reimbursed and what help we need.
Thanks, Josh. And the interactive map, the town data, does that include nursing homes?
Yes, it does.
So is there an argument that skews data then?
Yeah, it could. I mean, for a town that has a disproportionately high percentage of their over 75 population in nursing homes, that could be the case, but I don't think many towns would fall into that category.
Thanks. And finally, Josh, on the community spread in restaurants, has there been arguably a significant community spread to patrons or not? I mean, I know that the governor wants to increase the hours, but do you have you gotten down into community spread numbers in restaurants?
I think the team at TPH has shared previously some of the outbreak investigation data that they and our partners in local health have gathered, and that has at times showed some clusters in and around restaurants, but in the grand scheme of things, relative to the total number of cases in the state, it continues to be a pretty low percentage. But that said, we want to remind people that if they do go out to eat, please follow the rules, take every precaution, and do so safely.
Hey, Governor, have you limped down to a restaurant lately for indoor dining?
Oh, good turn of phrase, Ken. I'm getting around better these days. Have not been to a restaurant recently, though. No, I was a big outdoor dining guy. Although I've eaten in a couple of tents over the last couple of months, and it's been pretty nice.
Thanks. And finally, the Democratic leaders today offered up $114 million pilot increase program that's going to become part of the budget. And I'm wondering, with the recent increase in sales and income taxes, whether that's something that you might find easier to look at here with 9 days left before you present a budget.
What was that? 114 for what?
For pilot payment in lieu of taxes for hosting hospitals and colleges. And
so here's the deal, Ken. You know, we're in pretty good shape for this current fiscal year, ends on June 30. But going forward in the next 2 years, there is still a shortfall, and that shortfall is related in part to revenues. And depending on what happens with the stimulus bill, you could see revenues stay flat, revenues go down if the Senate decides they don't want to do anything, or revenues go up quite a bit. So we're going to have a lot more clarity, I think, by March or April in terms of what we got to do. In the meantime, I got a budget address that's in a little over a week, and we will be addressing pilot there and doing what we can in the near term to help our towns and municipalities that have a lot of untaxable public property.
Thanks, Governor. Thanks, Dr. Vasquez.
Thanks, Ken.
Thanks, folks.
CT News Junkie.
Thanks, Max. Governor, while we were all here talking, the Restaurant Association released a press release saying they appreciate you raising the curfew, but they want to know, would like you to lift it altogether. Massachusetts, Rhode Island have done that, I guess. What's it going to take for that to happen?
That's going to take a little bit longer. Most people have finished their meals by 11 o'clock at night. I don't know what happens between 11 and 2 in the morning. I hope it stays a restaurant, but you can't always enforce it that way. I think New York and other places have found that a curfew, even an extended curfew, can make a real difference in terms of making sure restaurants are there for food.
Gotcha. Josh, presumably very few people are getting tested today. Are you guys releasing numbers tomorrow? What are we looking at tomorrow?
Yes, we will release numbers tomorrow as usual, and I'm sure you're right. I'm sure there will be some dip in the testing volumes from today.
Okay. That's it for me. Thanks, everybody.
Thank you. Yeah, I think that's it. Hey, Dr. Vasquez, thank you. Thank you for joining us today. Thanks for what you're doing on behalf of folks who've got to get vaccinated here in this state, and what you did with CDC and what you do for kids. And let me just say, we gave you some good news in terms of the numbers. And when it comes to infections, when it comes to hospitalizations, a lot of our key metrics trending in the right direction. Some of the better numbers we've seen in the last 2 or 3 months. I know we sort of went through this before some months ago, and then things, got worse again, as had been predicted in the fall, and what that could mean. I'd like to think this time is different. I'd like to think that you have infection rates going down and you have people getting vaccinated going up. I think that's a game changer. Right now, it's a game changer for some of our older populations, what a difference that makes. And as the British say, more jabs, more jobs. I think we've opened up our restaurants, opened up houses of worship. And as long as we're cautious and pay attention, there's some pretty cloudy skies out there, but somewhere behind there's the sun. And I think it's getting closer. Thanks, everybody.
Thank you.
Thank you.